Good morning again. So we will be starting with the endocrine module today. Okay, and do you know that the endocrine module, okay, it is being controlled by a gland which is present inside our head. Okay, and that's called as pituitary gland. Okay, the pituitary gland. Okay, it is also called hypophysis cerebri. Okay, hypophysis cerebri. Okay, the other gland. Okay, so the pituitary gland, the another name is hypophysis cerebri, and it's also called as a master gland. Okay, it's called master gland because it controls the other endocrine organs. What are the other endocrine organs? The other endocrine organs are the thyroid gland, the adrenal gland, the pancreas, the ovaries, and testes. Okay, so ovaries and testes are both reproductive as well as endocrine. Okay, what do you mean by endocrine? Because they secrete hormones. Okay, they secrete hormones. Okay, so these are the structures which are secreting hormones. Okay, so what is the difference between a hormone and an enzyme? Can anybody let me tell me? Hormone and an enzyme.
Maybe the hormone
Enzyme,
activated the function of the enzyme.
yes, very good. So the hormones are secreted by the endocrine glands, whereas the enzymes are secreted by exocrine glands. Okay, exocrine. So there are two types of glands. Okay, one is endocrine and another one is exocrine. Okay, so regarding those, the physiology they will be talking in detail about it. So what we are going to see is only about the structures of the endocrine gland. So we are going to start with the pituitary gland. The pituitary gland is located inside the skull. Okay, it is located inside the skull. Okay, below the brain. Okay, so as you can see here, the brain, it is situated below the brain. Okay, in a fossa, in a separate fossa in the skull. Okay, fossa means a depression. Okay, and this fossa is called as hypophyseal fossa. Okay, hypophyseal fossa, or it's also called as pituitary fossa. Okay, hypophysis cerebri. So this is called as hypophyseal fossa or pituitary fossa. Okay, how is it attached to the brain? It is attached to the brain by means of infundibulum. Okay, it is attached to the brain by means of an infundibulum. The pituitary gland has got an anterior part and a posterior part. The anterior part of the pituitary it's called as adenohypophysis and the posterior part is called as neurohypophysis. Okay, adenohypophysis, neurohypophysis. The anterior part is further subdivided into three portions, which is called as pars distalis, pars intermedialis, pars tuberalis. You can see all these things in this picture. So here you can see this is the anterior part of the pituitary and this is the posterior part of the pituitary. The anterior part of the pituitary is also called as adenohypophysis and the posterior part is called as neurohypophysis. Okay, the anterior part is divided into three parts: pars distalis, pars intermedialis, pars tuberalis. The posterior part, which is mainly occupied by the neurons, and that's why this is called as neurohypophysis. Okay, neurohypophysis. Okay, it contains pars nervosa. Okay, it contains pars nervosa. So this is the histological part of the pituitary gland where you can see all the structures. Okay, so it is attached to the brain by means of infundibulum. Here, if you see, this is the anterior portion, and this is the posterior part. Okay, pars distalis, tuberalis, intermedia. Okay, and this is the posterior most part, which is the pars nervosa. Okay, pars nervosa. Why it's called nervosa? Because it's mainly occupied by neurons. Okay, it's mainly occupied by neurons, which comes from the brain. Okay, from a part of the brain. Okay, so that we will discuss in physiology. Okay, now what are the relations of the pituitary gland? Here you can see the CT scan of a brain. Okay, the CT scan of a brain. Okay, the sagittal section. Okay, so this is the real one. And which do you think is the pituitary gland? Which amongst this? There are so many numbers, right? So which number amongst this is the pituitary gland? Number 6. So you can see it is a very tiny structure. Okay, so pituitary gland. Okay, so this is the pituitary gland. Anterior to the pituitary gland, you can see a small radiolucent structure, okay, which is mentioned as number 7, and this is the sphenoid air sinus. Okay, sphenoid air sinus. It's present both anterior as well as inferior to the pituitary gland. Okay, anterior and inferior to the pituitary gland. Okay, now posterior part. Okay, the posterior relation. So here once again, I'll show you in the previous picture itself. So this is pituitary gland. Posterior to the pituitary gland, what is situated? Here you can see number 10. And there is a small part of the brain, sorry, the skull. Okay, so here you can see number 10. This number 10 is called as pons. Okay, it's called as pons. And this bony structure of the skull, which is behind the hypophyseal fossa, it's called as dorsum cella. Okay, dorsum cella. Okay, so here this is the pituitary fossa or the hypophyseal fossa where the pituitary gland is present. So behind it, this part of the skull, okay, so which is present, so this is called as dorsum cella. Okay, it's called as dorsum cella. So these are the two structures which are located posterior to the pituitary gland, dorsum cella and pons. Now superior part. Okay, so here you can see the pituitary gland. Superior to the pituitary gland, here you can see a structure which is named as OC. Okay, OC. So what is this one? OC stands for optic chiasma. Okay, it stands for optic chiasma. Okay, you can write it down. Okay, so this is optic chiasma. So that is the part which is situated superior to the pituitary gland. Okay, superior to the pituitary gland, it is optic chiasma. Okay, optic means vision, something which is related to the vision. Okay, lateral part. Okay, lateral to the pituitary gland on either side, you can see some large venous connection which is called as cavernous sinus. If you remember in circulatory system, we have seen this one. Okay, cavernous sinus, which is located lateral to the pituitary gland. Okay, so once again, both anteriorly and inferiorly by the sphenoid air sinus, posteriorly by dorsum cella and the pons, superiorly by the optic chiasma, and laterally by the cavernous sinus. Now, why should I know about these relations? Okay, so why should I know about these relations? Because pituitary tumors are common in children. Okay, so pituitary tumors, if they enlarge, okay, tumor means cancer. So if they enlarge, they can expand laterally, superiorly, posteriorly, or anteroinferiorly. Okay, so if it expands to any one of these structures, it will compress the surrounding structures. Okay, so that can lead on to various symptoms. Okay, various symptoms. So that's why we need to know the relations of the pituitary gland. The blood supply of the pituitary gland. The blood supply of the pituitary gland is by superior hypophyseal and the inferior hypophyseal arteries. Okay, superior hypophyseal and inferior hypophyseal arteries. The functions, as said before, okay, so it will be discussed in detail by the physiology in your next semester. Okay, so but I'll just give you an overview. So it controls the other endocrine glands, okay, by secreting various hormones. But pituitary gland itself is controlled by another structure which is above the pituitary gland, which is called as hypothalamus. Okay, hypothalamus. Okay, now here you can see, so this is a 33-year-old man is coming with vision problems. Okay, so when you test the vision, what vision he is having? He is able to see only the structures which are in front of his eyes. Okay, just which is front of his eyes. He is not able to see the lateral part of the vision. So when you see, okay, you are able to see a small part of the lateral side. Okay, like who is coming on the sides. Okay, you will be able to see. Okay, but this person is having only like a tubular vision. Okay, now why could this be to? Okay, what can be this due to? So here if you see, this is a CT scan. Okay, and here this is the pituitary gland. Okay, and you know above the pituitary gland there is optic chiasma. Okay, so in case if the pituitary gland enlarges, it can compress the optic chiasma. And when it compresses the optic chiasma, it can lead on to visual problems like this. Okay, so that's why we need to know about the relations of the pituitary gland. Okay, any doubts?
No, doctor.
All right. So, what is the treatment for it? The treatment is for any pituitary tumor
Remove
is
it.
surgery. Okay, the treatment is surgery. Okay, so the pituitary tumor is compressing the optic chiasma, leading on to vision problems. Okay, so if such a patient comes, okay, so what is the treatment? Okay, usually we will go in for surgery. But how to do a surgery of a pituitary gland? Okay, see the pituitary gland is located here. Okay, so what we cannot, we can open the skull, remove the brain, and then remove the pituitary gland. Is it possible? It is possible, but it will be damaging a lot of brain. The most important structure in our body is the brain. And if the brain has lost its function, the person goes in for coma. Okay, like operation success, patient died, like that. Okay, so is there any other approach by which only the
From
pituitary
the
from the
nose?
yes through the nose? Okay, so through the nose, okay, the nasal cavity, they can pass a tube, and when they hit on the nasal roof, okay, the nasal roof, okay, in the respiratory module you must have heard the nasal roof boundaries. Okay, the posterior part of the nasal roof. Okay, if you cut open the, if you just dissect and open through this nasal roof, you will be reaching the sphenoid air sinus, and once you hit the sphenoid air sinus, then comes the pituitary gland. Okay, so this is another less invasive approach. So where the brain is not disturbed and we can treat it. All right. So this is one of the
Doctor, we cannot hear you.
Doctor, your voice is not clear.
Hello.
Yes, doctor.
Yes. Okay.
Now we hear you.
I hope now it is okay.
Yes.
Yes, doctor.
Okay. So the pituitary can be approached through the nasal cavity, okay, by passing through the sphenoid air sinus, because you know the inferior part of the pituitary gland is the sphenoid air sinus. Okay. So this is with regard to the pituitary gland. Okay. Any doubts?
No, doctor.
Okay. Now we can go to the next part, next gland. Okay. So this is a 34-year-old male. Okay. So he's coming with the neck swelling. So what could this swelling be due to? There are many things which is present in the neck, but the most important structure which is present here is the thyroid gland. Okay. Neck swelling should prompt, okay, a physician to go to the diagnosis of a thyroid gland. Okay, so let's see about the thyroid gland. The thyroid gland has got two lobes. Okay, so here you can see the two lobes of the thyroid gland, which is connected by an isthmus. Okay, this is one lobe, this is another lobe, right and left lobes connected by the isthmus, and there is a small part which rises up, and that's called as pyramidal lobe. Okay, so there are two lobes, isthmus and a pyramidal lobe. Okay,
Doctor, this is a
now,
neck?
yes, this is the sagittal section of the neck. Okay, so
Mhm.
inside the neck you can see the thyroid gland. There are two lobes, isthmus and the pyramidal lobe.
Yes.
Okay, now this thyroid gland is enclosed by a fascia. So this is the sagittal section of the neck. So here you can see this is the trachea. Okay, and this is the thyroid gland. Okay, and you can see the thyroid gland is enclosed by a red colored line. Okay, it is enclosed by a red colored line. Okay, and this line, it's called it's actually a fascia, which is called as pretracheal fascia. Why it is called as pretracheal? Because it is present in front of the trachea. Okay, pretracheal fascia. Okay, pretracheal fascia. Okay, so which it encloses the thyroid gland. Okay, it encloses the thyroid gland. Okay, it is because of this pretracheal fascia, the thyroid gland moves up and down. Okay, when a person swallows. Okay, say when the person is swallowing, okay, the swelling, the thyroid gland will go up and down, will move up and down. Okay, because you know this thyroid gland is attached to a bone, which is the hyoid bone. Okay, you can see the hyoid bone. All right. So the thyroid gland is enclosed by means of pretracheal fascia. Okay. Okay. So here you can see a huge thyroid swelling. Okay, in a female. Okay, and she is having difficulty in breathing. Why she is having difficulty in breathing? Because of the thyroid gland. Thyroid gland has got nothing to do with breathing. But why she is having difficulty in breathing? Because it compresses the surrounding structures. So we need to know what are the structures around the thyroid gland. Isthmus, okay, the thyroid isthmus. Anterior, you know, there is skin and fascia. Posterior, there is trachea. Okay, there is trachea. Okay, so it is because of this compression of the trachea, the person is having difficulty in breathing. Okay, now the lobe, the thyroid lobe, if there is enlargement of the thyroid lobe, okay, Anteriorly, neck muscles, and posteriorly there is an important artery which is called as carotid artery. You know, the carotid artery is a very important artery which goes and supplies both the head and neck and brain. Head and neck is supplied by the external carotid artery and the brain is supplied by the internal carotid artery. Okay, so posteriorly there is carotid artery and anteriorly the neck muscles. Okay, now medial. Okay, if the thyroid gland is there, medially there is pharynx, larynx, trachea, esophagus, and recurrent laryngeal nerves. I'll show you in this picture. Sorry, where is this? Yes. So here you can see the thyroid lobes. Okay, the thyroid lobe. Okay, so anteriorly there will be skin and fascia, right? You can see behind the isthmus there is trachea. Okay, you can see the trachea. Okay, now posterior to the lobes, you can see there is an artery which is the carotid artery. Okay, you can see the carotid artery. Now medial to the lobes, there is trachea, and behind the trachea there is esophagus, and between the trachea and esophagus there is a very important nerve which is called as recurrent laryngeal nerve. Now what does this nerve do? It is the one which is responsible for the production of voice. Okay, it is the one which is responsible for the production of voice. Okay, so if recurrent laryngeal nerve is damaged, the person will have hoarseness in voice. Okay, hoarseness, like it will be a strong voice. Okay, the recurrent laryngeal nerve. Okay, it supplies the vocal cords. Okay, which is responsible for producing voice. Okay, so here you can see a 54-year-old female who is undergoing thyroidectomy. Thyroidectomy means removal of thyroid. Okay, so in the removal of thyroid, post-operatively, the patient is having hoarseness of voice. Hoarseness means like the voice changes. Okay, hoarseness like that. Okay, so the voice changes. Okay, so previously she was having a voice. Okay, but after the surgery, the voice is different. Okay, now why is this due to? It's because of the involvement of.
Recurrent laryngeal nerve. It's
Very good.
damaged.
Very good. Okay, now let's go to the blood supply of the thyroid gland. The thyroid gland is supplied by the three arteries. One is the superior thyroid artery, inferior thyroid artery, and thyroidea ema artery. Okay, so there are three arteries which supply. Okay, but usually we won't ask you this. We will ask, where does the superior thyroid artery arise from? The superior thyroid artery arises from external carotid artery. The inferior thyroid artery is arising from thyrocervical trunk. The thyroidea ema artery is from the arch of aorta. Okay, and the veins, there are three veins, superior, middle, and inferior thyroid veins. The superior thyroid vein goes into internal jugular on the respective sides. The right sided superior thyroid goes to the right sided internal jugular. The left sided superior thyroid vein goes to the left sided internal jugular vein. Okay, same with the middle thyroid vein. However, the inferior thyroid veins of both the right and left, they join together and then they drain into the left brachiocephalic vein. Okay, so here you can see the thyroid gland. Okay, and here you can see the superior thyroid artery. Okay, the superior thyroid artery. The superior thyroid artery is arising from external carotid artery. Okay, you can see this is the common carotid artery. Okay, the common carotid artery, which is divided into internal carotid and external carotid. Okay, so the superior thyroid artery is arising from external carotid artery. The inferior thyroid artery. Okay, the inferior thyroid artery is arising from thyrocervical trunk. Okay, thyrocervical trunk. and you can see how closely the recurrent laryngeal, the yellow colored one, is the nerve. Okay, you can see how closely it passes the recurrent laryngeal nerve. Okay, so that's why during the removal of the thyroid, it's very difficult to identify this nerve. Okay, but you need to identify this nerve and preserve. Otherwise, the person will have hoarseness in voice. Now, the venous drainage, you can see it's supplied by superior thyroid vein, middle thyroid vein, and the inferior thyroid vein. The superior thyroid vein goes into the internal jugular vein on the respective sides, right to the right and left to the left. The middle also follows the same. The inferior thyroid veins, however, they join together and then they open into the left brachiocephalic vein. Okay, you know that the left brachiocephalic vein and the right brachiocephalic vein, they both join together to form the superior vena cava. Okay, we have seen that in the circulatory system, right? So this inferior thyroid veins, they will join together and then they drain into the left brachiocephalic vein. Okay, so this is with regard to the blood supply of the thyroid gland. Definitely at least 2 questions will come from this part. Okay, in this one. Okay, so please go through the blood supply of the thyroid gland. All right, any doubts until now? Any doubts? All right.
No, no.
Okay, so now we are going to the next part. Okay, so here it's also a case of thyroidectomy. Okay, in a female. Why female? Female because the thyroid gland enlargement is more common in females. Okay, so that's why we usually put it as the thyroid gland crisis. Okay, in females. Okay, so female who has undergone thyroidectomy. Okay, suddenly the nurse calls. Okay, because the person is having something. Okay, so can you see any abnormality in this picture? Here you can see
In the
the
hand
hand.
and
Her
finger.
hand?
Yes, a hand is going some. It's flexed. Okay, it's flexed near the wrist and then it's extended near the fingers. Okay, so this is called as main d'accoucheur. Okay, it's a French name, main d'accoucheur. Okay, so anyone knows French? Main means hand. Accoucheur, it's a midwife. Okay, midwife or obstetrician. Okay, it's also called as the obstetrician's hand. Who is an obstetrician? The doctor who delivers the babies. So what happens when they deliver the baby? They will hold the hand like this to receive the baby from the mother. Okay, so it resembles that hand, so that's why it's called as main d'accoucheur. Okay, so why this occurs? Okay, why this occurs in a post-thyroidectomy person? Okay, after thyroid removal, why this occurs? It is because of the parathyroid gland. So there is another gland within the thyroid gland, and this is called as parathyroid gland. Okay, so this is another gland which is present within the thyroid gland. Okay, it's called as parathyroid gland. These are very tiny structures. See, the size is around only 6 millimeters. Tiny structures. They are 4 in number and usually located along the posterior border of the thyroid. So here you can see the thyroid gland. Okay, and here you can see 1, 2, 3, 4. Okay, superior parathyroid gland and inferior parathyroid gland. Okay, the superior parathyroid gland is usually more constant in position and approximately in the middle posterior part of the thyroid gland. Okay, middle posterior part of the thyroid gland. Okay, the superior parathyroid gland. Whereas the inferior parathyroid gland, okay, the inferior parathyroid gland, it is not in constant position. Okay, it is not in a constant position. It can be present within the thyroid or sometimes outside the thyroid. Okay, so it can be present anywhere. All right. The blood supply of this parathyroid is same like that of thyroid gland by superior and inferior thyroid arteries, and the venous drainage is also the same, superior, middle, and inferior thyroid veins. Okay. Now, why does this occur? Why does this occur? Can anyone guess? Parathyroid gland. Why does this cause? What is the function of the parathyroid glands? The parathyroid gland is very important for controlling the calcium metabolism in our body. Okay, it controls the calcium metabolism in our body. Okay, and when this parathyroid glands, so during the surgery of the thyroid gland, okay, if accidentally this parathyroid glands are removed, what will happen? The calcium metabolism will be affected. As a result, the person will go in for hypocalcemia. Okay, hypocalcemia. Hypo means less, calcemia means less calcium. Okay, hypocalcemia. So when they go in for hypocalcemia, they develop this symptom. Okay, they develop this symptom. Okay, so when they see this symptom, okay, the doctor has to say that you need to check out the calcium levels, and then they need to give calcium. Okay, and the surgeon during the surgery of the thyroid gland, they need to know that there is parathyroid gland and leave a small portion of the thyroid gland along the posterior border. Okay, along the mid posterior part. If they leave a small amount of thyroid gland, so that might contain parathyroid gland, which is enough for the person to sustain. Okay, to maintain our calcium metabolism. If it is removed, okay, then they need to take up calcium regularly. All right. So this is with regard to the calcium. Any doubts until now? Any doubts?
Doctor.
No, doctor.
Okay. So we have seen about the pituitary gland, thyroid gland, parathyroid gland. Okay. So we have seen three glands today. Okay. Just two more glands. So one is the adrenal gland and the other one is the pancreas gland. Okay. So we will just see about this two. Okay, so we will see about this. We'll see about this. Okay, the adrenal gland. Okay, then the pancreas. I think we have already discussed. Okay, you know about the pancreas in the GIT. We have already discussed, and the thymus. Okay, the thymus which is present in the neck. So that also we will discuss. I think we will discuss this tomorrow. Okay, all right. So this is just very small. So tomorrow we will discuss about the adrenal, the pancreas, and the thymus glands. All right. Any doubts?